Cardiovascular disease burden in West Virginia is horrific, and we have to do something at a much higher level to really impact the care and the outcomes of our patients. And cardiovascular imaging is very integral to that. As part of this, we have the Force CT scanner. One of the reasons the scanner is so important is because it has such an important finite resolution where we can actually look at the plaque inside the arteries as well as look at valve function, almost like on a movie, so we can really define what the cause of the problem is. And this will take us into the future. So we're the first in the region to have CT FFR available. So now we can not only look at the anatomy on the heart arteries as part of assessing someone with chest pain, but we can look at the plaque as well, look at how bad the stenosis is, and also determine if that stenosis is bad enough or clinically significant to cause your symptoms of chest pain. This is so important because stenting a vessel only improves symptoms. It doesn't really improve our outcomes, but what we do know from our stent trials is that if you have an intervention to a blockage that causes significant ischemia, you do better. So we can give all of that information to the interventionalist so they can direct their care for better outcomes of our patients. The strength of cardiac MRI is really looking at the heart function. How is the heart squeezing? Looking at the muscle and characterizing what problems the muscle actually has. So other advantages are cardiac CT is a non-invasive way to look at your heart arteries. So again, when we're looking at chest pain, we're looking at, is the blockage in the heart bad enough to cause your symptoms? I like cardiovascular CT in particular because even if a stress test is normal, it only identifies if you have a problem when the blockage is over 70%. However, with cardiovascular CT, you can see if you have no disease, mild disease, or significant disease, and this allows us to actually start the appropriate medications at a much earlier stage. Echocardiography is essentially an ultrasound of the heart. Many times if you're pregnant, we look at our babies with ultrasound. So this is just, we put jelly on the chest or you swallow a tube to actually get a closer look at your heart valves and how bad the regurgitation or stenosis is, meaning how bad is the leakage, or are the valves having difficulty opening? How is our heart squeezing? This is the non-invasive way to look at that. It's taking those pieces of imaging information we're getting at the imaging center, and then how can we use that to implement change? Because seeing is actually believing. Sometimes it's very difficult for a patient to prioritize taking blood pressure medication because you just don't feel bad. But if you actually see an image that shows you have disease, this is what it looks like, then they may be more compliant in taking the suggestions you have to work on quitting smoking or taking the medication that is so critical for improving our mortality.